Hello, Durham Region, and welcome to Daytime. We've got a great show for you today, and we're going to kick it off by talking about your kids and the dentist. So if you have kids, you know how scary that first trip to the dentist is, but we are going to make it oh so easy for you. Dr. Sheri Margolian of Margolian Dentistry is here now to make that first trip to the dentist a breeze. Welcome to the show.
Thank you.
So I have two boys who actually really love the dentist, thank goodness, but it's a scary thing for a lot of kids. So let's start off by talking about when we need to bring our children to the dentist.
So the best marker is when the first tooth comes in, and usually that's before the age of 1. And you want to bring them in just to get to know the dentist, get to know the staff, and get comfortable in the environment. Also, it's good to get all that medical history of the records down, because if there ever is an emergency and you want to come in, you have everything already there, ready to go.
Okay, so that first visit is not necessarily going to be like a teeth cleaning as much as this is what we do at the dentist, that kind of thing?
Yeah, we just kind of talk to them, show them our fun tools, spinning toothbrush, put it on the hand, they have some fun, but nothing too invasive, just getting to know everybody and getting comfortable.
When do children normally get their teeth? When do they normally come in?
So the first tooth usually comes in around 6 months, and that's when you get the fun teething phase. I haven't gotten there yet with my 2-month-old daughter, but soon. And then the teeth start coming in until 3 years old. You have the first full set of baby teeth.
Okay, so somewhere in that time period between the first tooth and when they get all of their teeth, we want to make sure that they're at the dentist, they're getting used to it. When are they going to get their first cleaning?
So when you start coming in with the teeth at the first visit, that's when you don't do much. But after that, you start cleaning right away, whatever they have in their mouth. Start getting them used to the cleaning tools and go along. Every 6 months, you want to continue the cleanings.
Okay, so then let's talk about brushing at home, because as much as getting used to the dentist is important, caring for your teeth at home is just as important.
So you want to start off by getting them used to it really early. Getting into a routine, having them do it with you at home, and if they see mom and dad are doing it, they're more likely to do it as well. But you just want to make sure for the young ones that they're not swallowing too much toothpaste, because there's fluoride in it. It can affect the formation of the permanent teeth, so just keeping an eye on them. And when they're under 3, use just a rice grain size amount of toothpaste.
So barely any.
Yeah, and 3 to 6, about a pea size amount. So just very little bit there, and making sure they're not swallowing it.
And so when they're babies, like when those first 1 or 2 teeth came in, do you just, I mean, I used to use like a little finger toothbrush just to wipe it off. Is that something we should be doing?
Yeah, you can start with just even a wet washcloth. If they have no history in the family of cavities, everyone's doing well, then you don't even really need to use toothpaste at the start. You can, under 3, you can just use just water on the toothbrush and brush it like that.
Okay, and then you can introduce that toothpaste afterwards. Let's talk about parent assistance, because parents should be helping out, right?
Yes, under 6, you should for sure have the parents helping the kids. After that, they can start taking on more on their own. And around 9 years old, kids can start flossing on their own, but before that, you really want to be helping them. And every kid's a little bit different, so you have to see what your kid's level is, but for sure you want to be helping them, make sure they're doing it right.
So should we be flossing our kids' teeth right away?
As soon as the spaces between the teeth start closing up, because you'll see when they're young, there's lots of gaps between the teeth to make room for the permanent teeth. But when you see them coming together, food can get trapped in there, so you want to start getting in there with floss as soon as they start coming together.
All right, and then let's talk about the importance of baby teeth.
Yeah, so a lot of people out there think, oh, they're just baby teeth, we're going to get replacements, it's not too important, but they do have a really key role. For one, their appearance and for function, but one of the things that's really important is that they're the natural placeholders for our permanent teeth. So that if you lose one too early because of cavity or something like that, the teeth around them will shift into its spot, and they'll be harder to get room for that permanent teeth to come in, and there could be crowding, may need braces. So it is really important to keep them as long as they should be naturally.
So talk to me then about when they're loose. Should we not be yanking them out?
So once they're loose, it's time to go. Within a couple of months, it's not a big deal. But if their tooth is supposed to come out around 6 years old and it's coming out at 3, things are different,
that's an issue,
right?
And that's when we need to be concerned. Okay, so we really need to be taking care of those baby teeth then. We need to care about them.
Yes, for sure. Just like they're your adult teeth, just as important.
I'm learning so much. Talk to me about the role of diet and the way we, especially at nighttime, drinking that milk.
Yeah, so when we see cavities in children, it's most often because of having a sugary liquid, whether it's the milk or juice, right before bed in a bottle. So you do want to go to a cup as soon as you can, but important to have that last feed be water, because overnight the acidity in our mouth rises and we have less saliva production. And that's the perfect environment for cavities to grow and flourish there.
So when we're putting our baby to bed with a bottle, we're actually doing them a disservice.
Yeah, we got to do water for that last feed.
Okay.
And brush right before bed to keep it clean overnight so nothing's caked on there that can grow cavities.
You mentioned the bottle, switching to a sippy cup. Is it because the bottle is harming their mouth, or is it just because a sippy cup is more for water, generally speaking?
It's just because it's actually less is going on your teeth. When you're doing the bottle, there's more caking on there. The sippy cup is more back and it's going down the throat more, not caking on the teeth. So it's the combination of the two. You do want to use water though.
Okay, yeah. water
Yes,
at bedtime.
Yes.
Then why don't you give us a little demo of brushing teeth so that parents know what they should be doing?
So I'll show you here. For starters, you want to use a soft or extra soft toothbrush. Those are great for the teeth and the gums, not too hard on them. And you want to make sure you're getting into the gums at a 45-degree angle with the bristles and brushing away from the gums. That's sweeping everything away. And you want to make sure you're getting all surfaces of the teeth. So the front, the top, the inside, every surface. And of course you want to floss as well.
Okay.
But key is to sweep that debris away from the gums.
So we're going right up into the gums and sweeping down. And from the bottom, do we sweep up?
Exactly. Because sometimes people do this, back and forth, back and forth.
Yes.
And you're just kind of sweeping it from one tooth to the other. Getting it out of those areas, sweeping it away from the gums will get it out of the mouth there.
So when I was growing up, we always used to hear up like a rocket, down like the rain, back and forth like a choo-choo train, right?
That's perfect.
Yeah?
You got it.
Okay, good. And how long do we need to be brushing teeth for, especially those baby teeth? Do we need an extended brush?
2 minutes. That's the key for everyone. And they have good tools now. They have toothbrushes that play a song for 2 minutes that can keep you on track, but that's the timeline.
So the longer the better, essentially.
Yeah, you don't need to be brushing forever. you won't want to do too hard as well.
Yes.
Soft and for 2 minutes is the perfect amount.
Soft and for 2 minutes. Down at the top, up at the bottom,
Yeah.
back and forth on the gum. All this information is so fantastic. Wow, I wish you were around when I'd had my baby. I could have learned so much from you. We do need to take a break, but thanks so much for being here. Fantastic stuff. We got to take our first break, guys, but don't go anywhere. Lots more daytime to come right after this.